Thank you for joining us today. My name is, this is going to be the module Research and Data Collection, part of our Power Prism training series. My name is April Wallace. I'm the Senior Manager for Equity Strategies and Partnerships for Voices for Healthy Kids. And I'm joined by my colleague, Phil. Phil, would you like to introduce yourself?
Sure, thanks, April. My name is Phil Noyes. I'm a senior policy analyst with Voices in the NCIT.
Awesome. Next slide, please. So our objectives for today, we're going to provide you with an overview of the Power Prism, and then we're going to focus our time today on the research and data collection. That's one of the advocacy tools within the Power Prism framework. The Power Prism framework is a step-by-step plan that will help you to recognize and act on opportunities to build momentum in the campaign for change. Next slide. Our first step in building power for your advocacy is answering three key questions. Everything you do in your campaign should be informed and guided by your answer to these three key questions. Next slide. So it's tempting to want to jump right into advocacy methods and strategies, but winning policy change campaigns are those that are guided by these three questions. What do you want? Why do you want it? And who has the power to give it to you? Remember, you in these three questions above must include members of the community most impacted by the proposed policy change. So consider, what is the policy change you are seeking to address your issue? What data makes a case for your policy change? And then which specific decision makers have the power to make that change? Next slide. So influencing decision makers is all about making it easier for them to give you what you want. The Power Prism is built on 6 power tools of advocacy that help apply pressure on decision makers to really help you reach your policy goals. These 6 tools include the research and data collection, the coalition building and maintenance, fundraising and development, grassroots and key contacts, media advocacy, and decision maker advocacy. Next slide. So today we're going to focus on learning about research and data collection. For any policy campaign, it's essential to present data that defines the problem, the populations that are impacted, and science to support your policy solution. Without the data that explains the problem and justifies the solution, a proposed policy lacks credibility and is unlikely to gain support of decision makers. So as we will talk about later, there are many types of research that you will need to do to support your campaign, and Voices can help you provide those access to large bodies of research and data that will help you to be able to utilize for your campaigns. Phil?
Thanks, April. Next slide, please. Yeah, what I think is most exciting is that when we're talking about research and data collection, we're really thinking about this comprehensive. Yes, the scientific literature provides the basis of your policy approach, and that's important, but that's only one approach, one component. Strong research data alone would not guarantee campaign success. You really need a comprehensive approach. Next slide, please. Here is a list of some of the different types of research and data collection that you should be exploring. Research can cover everything from scoping out the problem you want to address to understanding the potential equity impact of policy approaches. Yes, it can feel overwhelming, but Voices has many resources and people to provide TA to help you on your journey. This training will help you understand the different types of research and how they strengthen your campaign. A couple of key things to remember. Your advocacy process always should start with research and data collection, and this is not a one and done situation. Research and data collection should be continuous and an iterative process. Okay, so let's go ahead and dive in. Next slide. So the first things first, you really want to understand the process, and you shouldn't overlook understanding what the change-making process is, so that you know what you need to do. So next slide. Figuring out the process helps tell you what level of government you want to impact, and if you are seeking a policy or appropriations change. And you're looking at key factors. You want to explore key factors like who are the key decision makers, who are potential bill sponsors, and timing and key milestones. Next slide. And you'll want to really gather this information in terms of the process of how to make the change, and you should ask around. You should use whatever resources you can to better understand the process as you're starting your advocacy campaign. So you're going to need to speak to multiple people. Often at city, town, and county and state level, there's a official clerk's office. And that's a good place to start your inquiry. But be patient and friendly with that process, because these are often trusted gatekeepers to decision makers. And so making a positive impact on them can be a really important first step. Next slide. Thinking about working in Indian country, you need to understand the policy change process in tribal nation governments is different than state or city making bodies. Any policy change done in tribal communities should be led by Native people, and we encourage you to approach this opportunity to work with and through tribal leaders to improve health and equity with respect and humility. Sometimes working on a tribal policy can really be trailblazing work, and can have an impact on other policy areas. It's noteworthy, for example, the Navajo Nation was the first area in the United States to pass a sugary drink tax and junk food tax before any other communities did in the US. Next slide. So it is also really important to understand, in addition to the process, but understand where community members stand on these issues. It's critical that you really seek community counsel, guidance, and practical feedback from members within the community that are intended to benefit from the proposed changes. Next slide. This slogan, which came from the disability rights movement, really captures it pretty well. Nothing about us without us is for us. No policy should be decided at a representative by any representative without full and direct participation of members of the group affected by the policy. Advocacy should always center the community through the entire process. This involves engaging diverse groups, especially those that have been marginalized from the political, social, and economic opportunities. Next slide. It's really critical for campaigns to pause and make sure that there's community voice in all phases of advocacy work, from the time that the idea is being explored to implementation and evaluation. Campaigns need to continuously work to engage those who are impacted by the issues. And that perspective on the ground will really be important in terms of shaping what success looks like. Your campaign should be connected to impacted communities, and you should work with the resources within the communities. So there are often great base building organizations and grassroots organizations that excel at engaging community members and developing ongoing dialogue to bring community ideas into action. Finding and building trust with those organizations should be a high priority. Next slide, please. So all the community-informed research doesn't necessarily need to be done by your campaign. Often it's already been done, or some of it has been done by other community partners or even national partners. I dropped in the chat a few different links that you can use for resources, both looking at national and local level. Local health departments, community coalitions, even nonprofit hospitals can can have reports that really can influence your campaign. For example, community health needs assessments done by nonprofit hospitals can be a really valuable resource to build upon. Next slide. So it is really important to develop an understanding of place, learn the history, and build connections between policy issues, the locations that have faced the greatest burdens in inequity, and those elected officials that represent those locations. Often the areas that are facing the greatest inequities today have a long history of facing inequities in the past. You can do research to make connections between a current issue and past policies that have shaped these inequities. Next slide, please. So redlining provides kind of a real powerful example of demonstrating the importance of place and also how some groups have received preferential treatment for resources while other groups have been discriminated against. Redlining was a federal policy beginning in the 1930s, and it really guided investments based upon racial and ethnic makeup of communities. Often you can see the impact of redlining today when you look at health outcomes. This map here is just an example from Little Rock, Arkansas. And I've included in the links some tools for mapping, as well as AHA's call to action on structural racism and our policy statement in terms of addressing structural racism. Next slide. And it's important for you to remember, it's very, very easy when you get pulled into data to just develop a real deficit framing, that you don't want to just have a deficit mindset. Building campaigns that advance equity and historically disadvantaged communities require advocates to really have an authentic level of interest and knowledge about that community, and becoming and remaining curious and respectful of the assets can shift how we enter and how we interact with communities. Next slide. And although we don't have time to do this right now, I do encourage you, and it is, I'll put the link back in the chat. We do have an exercise that you can do as a good example in terms of just starting to build those connections with historic events and past movements. It's a simple Google exercise in which you're using some keywords to then search the history of the geographic area that you're interested in. And now I'm going to go ahead and hand it over to April.
Phil. So when we're talking about key people and place research, you will need to research who the key decision makers are, what makes them tick, and gather information to choose a bill sponsor wisely. So we're going to talk a lot about the bill sponsor in a little bit. Next slide, please. So remember our third key question, who has the power to give it to you? We can dig in more to this question by asking, which specific decision makers have the power to make that change? Depending on where you're located, these key decision makers may be leaders of committees that your legislation may be initially heard in. Um, this could be city council leaders or other decision makers. What motivates these key decision makers? That's really important. And how will you access and influence these decision makers? Doing this research will help you identify the kind of data that will be most helpful to make your case and identify if there are gaps in research that you can fill through surveys. In addition, when you're conducting this research early in your campaign, it will help you find what we call pathways of influence or ways to connect with lawmakers on your issue through common interests or values or contacts. You may find that your organization already has some of these internal resources to help you reach the key decision makers. And doing research only on early on will help you plan who and how to contact most effectively. So we can this is also discussed further in our decision maker advocacy module, just as a a promo for that one. Next slide, please. So learning about our key decision makers, this helps us find our pathways to influence, and it really helps us to apply pressure. Um, Details about what motivates those decision makers is extremely important. So you want to find a way to connect data and research on your issue to their interests. That's a great way for you to get their attention and help them make a decision that hopefully favors your proposed policy. When you understand which key issues and decision makers, what they care about most, that's going to be very helpful. Knowing their motivation, whether it's education, it's public health, or aging populations, that's going to help you to connect your bill to their interest. This also may include their legislative history, the kinds of bills that lawmakers support and committees they serve on can tell you a lot about what they care about and the issues they're passionate about. Their family life. Think about their spouses, their children's careers, their children's schools, and what family life was like for them growing up. And then think about their community involvement. Organizations the lawmakers are champions for, their places of worship, and their memberships that they hold can give you a sense of what really motivates them. Next slide. So once you've done your homework on a key decision maker, then you need to figure out how your sphere of influence matches up with their world. You want to cross-reference your list of assets with the data and info you discover about your lawmaker, your key lawmakers through your research. When you find those common interests or those hits, you found a possible pathway of influence to that key decision maker. That could be, again, finding one of your board members is an alum of the same sorority or as your key decision maker, or the invited board member, you can invite the board member to see if they have a personal connection and or if she requests an invite to a meeting with your decision maker. Um, or perhaps you learn that your key decision maker has a passion for competitive games, or one of your coalition organizations holds some monthly event, and you think the decision maker might be likely to attend. These are all ways, or through church or worship communities, you can find these different ways of influence. So again, this is covered more in more detail in our decision maker advocacy module. But just think about those different pathways of influence and where there might be connections throughout the community, through family members, through friends, and again through those places or causes that they feel passionate about. Next slide. So let's talk a little bit about the bill sponsors. Your bill sponsor is your most important legislative champion. You want to be strategic about choosing a sponsor. And so you want to choose wisely to set a strong foundation for the campaign. You want to make a list of potential lawmakers to consider before jumping at the first option. It's going to be important to identify connections and potential sponsors that may have. It's going to be important to identify connections potential sponsors may have to your legislation. Are they the lawmaker who represents you or your coalition partner? Do they have an organization that is key champion of your legislation or in their district? Have they proposed legislation in this arena before? Do they have a connection to children's health or economic supports for families? It is important to determine if your lawmaker has allies throughout your legislative process. If you've done some early homework to figure out which committee will first hear your bill or who chairs that committee and who will be in the leadership of the House of Representatives, Senate, or City Council, you want to make every effort to select a bill sponsor who is liked and respected by those leaders. If your bill sponsor does not get along well with leaders for your committee of your committee of jurisdiction or your legislative leadership, expect each step of the process to be a little bit more steep. Um, you may also you may also be lucky to know a professional lobbyist who works in an organization you are friendly with or in your coalition. People in these positions can provide you with an incredible amount of unofficial information about the elected officials and decision makers because they are working directly with these lawmakers each day, and they can offer um, thoughts about their personalities, how they approach certain lawmakers, and who has great staff that you can work with. They can let you know who gets along with whom and dynamics between lawmakers. This may sound silly, but knowing who gets along with legislative leadership and who does not will influence your chances of success. The last thing you want is to find out that an important committee chair or Speaker of the House cannot stand the person you sought out to be your bill sponsor. Next slide. So your bill sponsor is your key legislative champion. You want to make sure that this sponsor is strong, is diverse and bipartisan, and your list of co-sponsors sets a table foundation for your campaign. In many states, it is advantageous to file two versions of the bill, one in the House and one in the Senate, to improve your chances of building momentum. That means having a strong House sponsor, um, and ideally, those sponsors can work together collegially if needed down the line. If you have only one strong champion willing to support your bill, ask them to help identify a sponsor from the other chamber. They may have someone that they can recommend. Next slide. So the co-sponsors for your bill. Oftentimes bills can have co-sponsors, and the list of co-sponsors can be an important source of information about the insider support for your bill. So you want to consider a few things while you're thinking about enlisting co-sponsors. Um, they will not usually make or break your bill, but you will want to have a strong backup to your lead sponsor in case they leave office early or fall out of favor with leadership. Strive for bipartisanship. The opposition party is less likely to kill your bill if there's if some support for it within their own ranks. You want to aim to have co-sponsors from each region of the city or state. You want to demonstrate broad support. Because these issues that impact many communities, you want to seek a co-sponsorship list that is inclusive by race and ethnicity, gender, and other important identity groups in your local area. You want to recruit unlikely bedfellows. Of course, you will be able to win the support of the health advocates in the legislative body, but what about the fiscal watchdogs, economic development, or criminal justice champions? If you know which committee your bill will likely be assigned to, try to get a few members of that committee signed on as co-sponsors to give you inside information about its status. And I'll toss it back to Phil.
Thanks, April. Yeah, that's really great. I mean, you're really helping draw out what a comprehensive approach we're talking with research and data collection. You know, you're saying, hey, you got to figure out who likes who, and that matters in this process. So another piece of this is really thinking about who's going to be opposed, and you shouldn't overlook understanding the opposition. Next slide, please. Opposition can take many forms. It can be industry interests that oppose policies that may impact their bottom line, or key decision makers that oppose the policy because they feel like it impacts their district in one way or another. Understanding who has historically opposed your issue and working with your bill sponsor to understand their sense of who opposition could be will help you plan to present data that counters their potential arguments. It really can be tempting for advocates to think that they don't have any opposition because of the goodness of their cause. But most policy issues have at least two sides to the story. So explore those three key questions that April was mentioning before, but explore them from the perspective of the opposition. What do they want? Why do they want it? And who has the power to give it to them? Look out for situations where the opposition simply fear that if you win, they lose. This often happens when there are limited resources. Say in state and local budget battles, when winning funding for your cause may be at the expense of somebody else's priority. Try to neutralize these potential opposition forces through relationship building and information sharing. Next slide, please. Do the research to understand and reframe the opposition argument. To understand the opposition's arguments, you should be looking at public statements, forms of testimony, as well as opposition statements to the press, and how they position their issue in their own media, advertising, and communication channels. And one of the best ways to learn who your opponents are and what they are saying is to directly ask elected officials when you meet with them. Have you heard from somebody opposing the bill yet? We'd appreciate the chance to respond to any concerns that might be raised. If you do know the lawmakers that oppose the proposal, don't be afraid to ask for a meeting. Be upfront and say that you're not expecting to change their mind, but you just want to learn more about their point of view. Take notes and share those message points back to your coalition so you can be reframing and addressing the opposition's arguments. Next slide. And I do want to put a plug in here. Messaging really matters. And Voices for Healthy Kids, as well as other partners, have conducted message testing research. And that can help advocates make their best case possible. We can share with you I'm sorry, I'm going to cough. Sorry about that. Trying to make it through this slide. We can share with you what's been used elsewhere by other locations, in other locations, and by other groups. Message research builds on your local research, so you know how to put your best foot forward and how to frame your opposition's position. It's really important that you make sure that in your message research, in your messaging, that you're using health equity talking points, and these talking points really resonate with the key decision makers that you're trying to influence. April, back to you.
Thanks, Phil. So now that you have an idea of the research that will help you in planning your campaign, it's time to build your case. Next slide. So don't worry about turning your key decision makers into experts on your issue. That's not required. All you need to do is build a case that appeals to them and their supporters. Luckily, we have already many resources that you can use to gather important information on the problem and the policy solutions. Research into the problem you are trying to address will need to be shared with your grassroots advocates, your prospective coalition members, your lawmakers and their staff, public officials, and the media. Next slide. When presenting the problem, we want to make sure that we have data that at minimum will include this information, your scope of the problem to demonstrate how many people are impacted, the health effects of the problem, your demographics information and characteristics about those most impacted, and highlighting health inequities, and then your impacts of systemic racism on health inequities. Next slide. So here's, again, localizing and personalizing the problem. To the extent that you can, you want to gather this local data, and this is going to make the problem relevant for those decision makers. Make sure you have the data on the problem by district, city, or region, data on problem highlighting, again, those impacted key populations, and then the history of inequity and systemic racism, which kind of goes back to what we were talking about a little bit earlier in terms of um, you can do a quick Google search. If you do a Google search right now and just put in maybe the history of your current location, and that will probably start to give you just a little bit, some surface information about some of the historical things of that place that could also be rooted in systemic racism and health inequities. So make sure that you're personalizing the data and personalizing the problem so that it is relevant and really resonates with the decision maker. Next slide. So Voices Fast Facts is here. Oops, did we skip a slide? Maybe I took out a slide. Oh, there we go. Thank you. We have our Voices Fast Facts. We know that there are many campaigns. When working on campaigns, you have materials that are often created on a quick turnaround. And in order to provide campaigns with the resources needed to run effectively, Voices for Healthy Kids and the American Heart Association, we have our science approved fast facts for each of our policy issues. So there is a link, I believe we can drop it in the chat, that will take you directly to our fast facts. Did I drop it in the chat, Andrea? Or can you do it for me?
Yeah, I've already put it in, but I'll put it in again.
Thank you. So these documents provide facts from up-to-date studies and fast facts. They're written in consumer-friendly language. And so again, this helps to reduce your time spent doing research, but also provides the data, the science approved data powered by the American Heart Association. Next slide, please. So we also have success stories. They provide a quick way to research how others have led and won campaigns just like yours. The lessons learned research may give you some great ideas about campaign strategy. They may also give you ideas about experts and that you might want to ask to talk to your local media or lawmakers about how your policy change effort, how policy change effort worked elsewhere. Next slide. Our job at Voices is to really try to make this easier for you to plan and run a successful policy change campaign. And that's why we've developed lots of campaign toolkits for our priority policy issues. These toolkits include the success stories that you can share with your coalition partners, lawmakers, and the media to inspire them to act, and they can provide inspiration and guidance for you in your own campaign. Next slide. So it's really critical to also present how the problem will be improved. by your proposed policy. So whenever possible, make this local and personal to lawmakers you are trying to persuade. Remember to appeal to how they will create change in their own district and areas. And look at how your solution can reframe opposition arguments, or use that data directly, use data that directly counters what the opposition is claiming. And make sure to use the Voices for Healthy Kids tested messaging as a part of this. I'll hand it back to Phil.
Thanks, April. Yeah, and thank you for going ahead and starting to dig into the resources. Like I feel like this is the nice part of the presentation where we're just trying to give things away, and we really want to help you in terms of reaching your advocacy goals. And Rachel in April talked about Fast Facts, which is great, a great resource that you can just kind of cut and paste because it's already been science approved. Another process is, oh, next slide, I'm sorry. Thank you. Another resource that we can provide you, although it's a little bit slower, is putting something through our AHA science review. Say you're putting together a document or something that's going to be disseminated, and you want to make sure you're using the best data and the most recent data. That is something that you can submit a request for, and we could have our scientific team review it. The shortcoming of that is that it takes a couple weeks. And I should say all of these resources that we're talking about, you simply go to the Voices for Healthy Kids TA portal and put in a request. And that's how you start the process. So science review, fast facts, polling and messaging help, legal review as well. And a couple other resources that I just wanted to kind of highlight, and I put in a document talking about our Fair Start Index. Voices for Healthy Kids developed a Fair Start Index to really strengthen our equity impact. And we developed this with the help of county health rankings and roadmaps, as well as with other equity experts. And it provides a way to compare counties as well as states on different levels of opportunity, health opportunity, and economic opportunity, and educational opportunity, and as well as it looks at life longevity. So what the Fair Start Index does is it provides a percentile ranking so that you can compare communities, and you can really find the communities where children have the most opportunities and live the longest lives, as well as those communities and states where children have fewer opportunities and live shorter lives. And we use this as a way to really make sure that we're reaching those locations and engaging those groups that are facing the greatest burden, the greatest barriers to health. Another tool that you can put in a TA request around is a data storytelling platform. It's called My Sidewalk. I've provided a couple of links there. And I've also provided an example of both how you can put together a data story with My Sidewalk and include data and a narrative and pictures and graphs, and that data can be data from the census or the behavioral risk survey, or even you can be uploading your own local data. So that's another resource that we can offer to help support your advocacy efforts. Next slide, please. And this slide here just lays out all the different like types of technical assistance requests that you can make. And I think there's an other too if your request doesn't fit there. And I've highlighted in red, the ones that pertain to research and data collection. But obviously, there are many other areas where we can provide technical assistance. Next slide. And this link should be in the chat as well. If you are working on policies that impact expectant parents, infants, toddlers, and kids and their families, and you just want a free consultation, you just want to talk to somebody about your campaign and get some ideas, that's a way to do that, and to just connect with one of our national consultants. So lots of resources out there for you to utilize. Next slide. So trying to pull this all together, we really want to emphasize that research and data collection should be a continuous process that you do throughout your campaign work. You need to learn about the individual lawmakers, especially those that have the power to give you what you want. And you need to utilize all the power tools to influence key decision makers. And remember that research and data collection, it takes time, but through it, you're building a strong platform that will help secure the rest of your campaign work. Next slide. And these are themes that both April and I have been hitting, but here it is again in a little bit of a different format. And that is really you want to try to do research and data collection and emphasize the localized story and emphasize the ways in which you can get the attention of the key decision makers that you want. Sometimes that's through youth. Elected officials often really pay attention to youth stories, and that could be youth surveying efforts or other ways to elevate the youth voice. Personal stories are very, very compelling, and the last thing to say is is to recognize that you don't need to do this alone, that collaborating with local partners is an important way to build your case. Next slide. All right. And so you can see research and data collection from our framework really is a comprehensive approach, and strong campaigns gather research at every step of the way. And I wanted to leave you with a couple of quotes here. And the first is from Brene Brown, and that is, "The power of statistics and the clean lines of quantitative research appealed to me, but I fell in love with the richness and the depth of qualitative research." Our very own chief medical officer at the AHA, Eduardo Sanchez, said it this way, which I think is really powerful, and that is, data make you credible, stories make you memorable. And to win policy campaigns, you need both. And next slide. And as we've been saying, research and data is very important to us. So we would love to get your feedback on this training. I know it was a whole lot of information, and we've used up almost the entire hour. But I really want to encourage you to use the QR code, and we will pop in the chat the link to the post survey. And while you're doing that, we can field some questions. April, before we take any questions, are there any kind of final points that you want to emphasize before we open it up?
No, I think you really covered it. I always go back to the importance of including community from beginning to end, and not just as experts or leveraging them as experts, but also including them in every step of the process, and making sure that that voice is always heard, but also amplified throughout the process of the policy change.
All right. Shall we open it up to questions? If you have any questions or issues that you want to raise for April and myself, go ahead and come off mute or put it in the chat. Logan, go ahead.
Hi, thanks. That was really great. So one thing that I'm wondering if you guys have encountered in any techniques to conquer this. I have I work a lot I work in Pennsylvania, but we do a lot of bills with city council in Philadelphia. And in Philly, and I don't know if this is true and if you guys have heard this, but if let's say you start working with a legislator and then they just don't go anywhere with it, it's impossible to get that bill off of their desk and to get it into another council person's office. So, and do you understand what I'm saying by that?
That you can basically run into a dead end.
Yeah, you
Yeah.
give them a bill and then they just sit on it for years and you're like, hey, can I move this to another office? And they're just so territorial about it. I've often heard them say, well, they've always said no. And other council members won't take it on if someone else already has it. So I don't know if you guys have encountered that or if anyone else has. And if you have, maybe any techniques for working on that.
April, do you have anything to kind of speak to that? And Logan, if we can't answer you on this call, we can get a national consultant
For
to
consultants,
circle
yeah.
back to you. Yeah.
Yeah,
Anything?
I cannot speak to that. And I'm actually curious about how that happens myself. And if anyone who's on the call has potentially any solutions, that would be great. But I do think that it would be wise to connect you with one of our national consultants who definitely has experience there in terms of what could be done to get that moved and to kind of remove that dead end for you.
Thanks.
Well, you stumped us from the beginning, so we'll open it up to somebody else.
Yeah, I can't imagine that it's a unique thing to Philly City Council. It's been very frustrating, and I guess goes to show how important selecting a sponsor is. I have done a number of bills, and honestly, that is one of the most important things, is really picking a good sponsor, someone who's going to really help you with it and be interested in pushing it, and not just like you're not just annoying them all the time with it.
Other questions or thoughts? Okay, I'm going to give it the last call.